Well, hello everyone and welcome to Surgical Utopia. Today we will be discussing about the levels of lymph nodes in the neck region. So, as you all know that lymphadenopathy is a significant clinical finding which is associated in conditions of acute infection, autoimmune diseases and malignancy. So, the involvement of a certain lymph node indicates pathologically affected organ or tissue that is drained by that specific lymph node. The head and neck region contains rich and elaborate network of the lymphatic chain which are divided into various groups and are classified into levels. The knowledge and understanding of these levels are important in order to treat the malignancy of head and neck region either by surgery or by radiotherapy. So now we will discuss the levels of the lymph node in the neck region one by one. The first one is the level 1A. It is also called as submental group and anatomically it is bounded by mandible superiorly and laterally, and inferiorly it is bounded by hyoid bone. Anteriorly platysma muscle is present and mylohyoid muscles are present posteriorly. Laterally, the anterior belly of digastric muscle is present and medially a virtual anatomic midline is present. So these boundaries will form a triangular region which is termed as submental triangle. The submental nodal group will drain the skin of the mental region or chin and the middle part of the lower lip, the anterior portion of the oral tongue and the floor of the mouth. The involvement of these lymph nodes will indicate the presence of malignancy in the floor of the mouth, anterior oral tongue, mandibular alveolar ridge, and the lower lip, as the malignant deposits from these regions will reach the submental nodal groups in the level 1A region of the neck. Then coming to the level 1B, which is called as submandibular group, it contains the submandibular nodal group and its boundaries are as follows. The mylohyoid muscle will be present superiorly and hyoid bone is present inferiorly. Anterior boundary is formed by symphysis mentae and the posterior edge of the submandibular gland is present posteriorly. The inner surface of the mandible is present laterally and digastric muscle is present medially, and these boundaries will form triangular region which is termed as submandibular triangle. The submandibular group will drain the lymphatics from the level 1A region of the neck along with the lower nasal cavity, both hard and soft palate, maxillary and mandibular alveolar ridge, and it will drain the lymphatics from skin and mucosa of the cheek, both upper and lower lips, and the floor of the mouth, along with the anterior part of oral tongue. The submandibular group will contain its metastatic deposit from the malignancy of the oral cavity, of the anterior nasal cavity, the soft tissue of midface, and the submandibular gland. So the malignancies of these regions will metastasize to the submandibular group of lymph nodes in the level 1B region of the neck. Then we have level 2, which is called as upper jugular group, and it presents the beginning of the jugular chain. It is present adjacent to the top third of the internal jugular vein and the upper spinal accessory nerve. The upper jugular group is bounded by the insertion of posterior belly of digastric muscle into the mastoid process superiorly. The caudal border of the hyoid bone is present inferiorly. The posterior edge of the submandibular gland is present anteriorly, and the posterior edge of sternocleidomastoid muscle is present posteriorly to this group. The medial surface of the sternocleidomastoid is present laterally, and medially the internal carotid artery and scalenus muscles are present. The upper jugular group will receive its drainage from the face, parotid gland, level 1A, level 1B, and retropharyngeal nodes, and it will receive direct drainage from the nasal cavity, the entire pharyngeal axis, the larynx, external auditory canal, middle ear, and the sublingual and submandibular glands. The malignancy of the nasal and oral cavities, nasopharynx, oropharynx, hypopharynx, larynx, and major salivary glands will metastasize to the upper jugular group or level 2, and it is also the most commonly involved nodal level of the neck. So now moving further to level 3, which is called as middle jugular group. It contains middle jugular nodal group, which is present adjacent to middle third of internal jugular vein. This level is bounded by the caudal border of the hyoid bone superiorly and the caudal edge of the cricoid cartilage inferiorly. Cricoid cartilage is also considered as the surgical landmark, the plan where the omohyoid muscle crosses the internal jugular vein. Anteriorly, it is bounded by the anterior edge of the sternocleidomastoid muscle and posterior one-third of the thyroid muscle, and posterior border of the sternocleidomastoid muscle is present posteriorly. Laterally, medial surface of the sternocleidomastoid muscle is present, and medially internal carotid artery and scalenus muscles are present. The level 3 nodal groups drains the efferents from the level 2 and level 5. And other region where it drains the efferents are from retropharyngeal, pretracheal and recurrent laryngeal nodes. It receives direct drainage from the base of the tongue, tonsils, larynx, hypopharynx and thyroid gland. The level 3 will receive its malignant deposits from the oral cavity, nasopharynx, oropharynx, hypopharynx and larynx. So again, the metastasis is from all those areas where level 3 is draining the lymphatics from. Next, we'll discuss level 4A, which is called as lower jugular group, and it contains the lower jugular nodal groups adjacent to the inferior third of the internal jugular vein. It is bounded superiorly by the caudal border of the cricoid cartilage and inferiorly by a virtual level 2 cm superior to the sternoclavicular joint. Anteriorly, it is bounded by the anterior edge of the sternocleidomastoid muscle and the body of the sternocleidomastoid muscle, and the posterior edge of the sternocleidomastoid muscle is present posteriorly to this level. Laterally, medial edge of the sternocleidomastoid muscle is present, and medially, the medial edge of the common carotid artery, the medial edge of the thyroid gland and scalenus muscles are present, and medial edge of the sternocleidomastoid muscle is present more inferiorly on the medial aspect. This group drains the larynx, hypopharynx and thyroid gland, and it will also drain the lymphatics from level 3 and 5 and partially from the retropharyngeal, pretracheal and recurrent laryngeal nodes. So level 4A will drain the same region as that of level 3, except that level 3 will also drain lymphatics from the base of the tongue and tonsils. The level 4A will receive its malignant deposits from the malignancy metastasizing from the region of hypopharynx, larynx, thyroid, cervical esophagus and the anterior oral cavity. Next, we have level 4B, which is called as medial supraclavicular group, and it is a continuation of level 4A to the superior edge of the sternal manubrium. The boundaries are that it is bounded anteriorly by the deep surface of the sternocleidomastoid muscle. Posteriorly, it is bounded by the anterior edge of the scalenus muscle and the lung apex, the brachiocephalic vein and artery on the right, as well as common carotid and subclavian arteries on the left. Laterally, it is bounded by the lateral edge of the scalenus muscle and medially by the medial border of the common carotid artery adjacent to the level 6. Level 4B receives its drainage from larynx, trachea, hypopharynx, esophagus and thyroid gland, along with the efferents from the 4A and 5C level and partially from the pretracheal and recurrent laryngeal nodes. The metastatic deposits from malignancy of hypopharynx, subglottic larynx, trachea, thyroid and cervical esophagus will reach the level 4B. Next, moving to level 5A and 5B, which constitute the posterior triangle group, and it is situated posterior to the sternocleidomastoid muscle and adjacent to the inferior portion of the spinal accessory nerve and transverse cervical vessels. Superiorly, it is bounded by the superior edge of the hyoid bone and inferiorly by the vertical plane crossing the transverse vessel. It is bounded anteriorly by the posterior margin of the sternocleidomastoid muscle and the anterior border of the trapezius muscle posteriorly. Platysma muscle and skin are present laterally, and the levator scapulae and scalenus muscles are present medially. This group is divided into 5A and 5B by a virtual plane at the inferior edge of the cricoid cartilage. The 5A group is present above the virtual plane and 5B is present below in the posterior triangle. Level 5 receives the drainage from skin of the lateral and posterior neck and shoulder, the nasopharynx, oropharynx, and thyroid gland, along with the efferent lymphatics from the occipital, retroauricular, occipital, and parietal scalp nodes. The malignant deposits will metastasize from the nasopharynx, oropharynx, and thyroid to level 5. Moving further, we have level 5C, called as lateral supraclavicular group, and it is a continuation of 5A and 5B level, which contains the lateral supraclavicular group. It is bounded superiorly by a virtual plane crossing the transverse vessel and inferiorly by a virtual plane 2 cm superior to the sternoclavicular joint. Anteriorly, it is bounded by skin, and the anterior border of trapezius muscle is present posteriorly, along with serratus anterior muscle. Laterally, it is bounded by trapezius muscle and clavicle, and medially it is bounded by scalenus muscle and lateral edge of sternocleidomastoid muscle. The level 5C is present directly adjacent to the lateral edge of level 4A. It receives its drainage from the level 4A and 4B, and it will receive its malignant deposits metastasizing from the malignancy of nasopharynx. Further, moving to level 6, which is called as anterior compartment group. This group is present anatomically in the midline, and it is further divided into superficially located anterior jugular node or level 6A and deeper prelaryngeal or pretracheal and paratracheal nodes, which is named level 6B. The level 6A is bounded superiorly by the inferior edge of the level 1B and inferiorly by the superior edge of the sternal manubrium. It is bounded anteriorly by skin and platysma. The posterior boundaries are formed by the anterior surface of the intrahyoid muscles and bilaterally by the anterior edge of the sternocleidomastoid muscles. The level 6A drains the integuments of the lower face and the anterior neck, and it receives its malignant deposits from the malignancy metastasizing from the lower lip, the soft tissue of the chin, and advanced gingiva mandibular carcinoma. The level 6B is bounded superiorly by the superior edge of the thyroid cartilage. The superior border of the sternal manubrium forms the inferior boundary, and anteriorly it is bounded by the posterior margin of the infrahyoid muscles and posteriorly by the anterior larynx, thyroid gland, and trachea at the midline. The common carotid artery forms the lateral boundary, and the lateral aspect of trachea and esophagus forms the medial boundary of level 6B. This level receives its drainage from the anterior floor of the mouth, tip of the oral tongue, lower lip, thyroid gland, glottic and supraglottic larynx, hypopharynx, and cervical esophagus. The metastatic deposits will reach to level 6B from the malignancies of lower lip, oral cavity, that is the floor of the mouth and anterior oral tongue, glottic and subglottic larynx, the apex of the pyriform sinus, and cervical esophagus. Next, we will move to level 7, which is prevertebral compartment group, including levels 7A and 7B levels. The 7A is also known as retropharyngeal nodes. It is contained in the retropharyngeal space, and they are divided into medial and lateral subgroups. The lateral subgroup are bounded superiorly by the superior edge of the C1 vertebral body or the hard palate, and inferiorly it is bounded by the superior edge of the body of the hyoid bone. Anteriorly, the posterior edge of the superior middle pharyngeal constrictor muscles are present, and the posterior boundary is by the longus capitis and longus colli muscles. Laterally, it is bounded by the medial edge of the internal carotid artery and medially by a virtual line parallel to the lateral edge of the longus capitis muscle. The medial group of the retropharyngeal nodes are approximated at the midline and not well defined. The drainage is from the nasopharynx, eustachian tube, and soft palate, and the malignant deposits in level 7A metastases from the nasopharynx, pharyngeal wall, oropharynx, including the tonsillar fossa, and soft palate. Level 7B is called as retrosteloid nodes, These nodes are contained in the fatty space surrounding the large vessels of the neck, leading to the jugular foramen. It is the superior continuation of level 2. The level 7B is bounded superiorly by the jugular foramen at the base of the skull and inferiorly by the inferior edge of the lateral process of C1 vertebral body, the superior boundary of the level 2. These nodes are bounded anteriorly by the posterior edge of the prestelloid parapharyngeal spaces and posteriorly the C1 vertebral body and base of skull. The lateral boundary is by the stelloid process and deep parotid lobe, and medially it is bounded by the medial edge of the internal carotid artery. The 7B nodal group drains the efferents from the nasopharynx and it receives the malignant deposits from the malignancies of nasopharynx and anywhere in the head and neck, resulting in significant infiltration of upper level 2 nodes causing retrograde flow. The next level is level 8, which is called as parotid group, and it includes subcutaneous preauricular superficial and deep intraparotid and subparotid nodes. The boundaries of level 8 is that it is bounded superiorly by the zygomatic arch and external carotid artery. Inferiorly, it is bounded by the mandibular angle. Anteriorly, posterior edge of the mandibular ramus is present, and posteriorly, the masseter muscle is present, along with the medial pterygoid muscle. Posteriorly, it is also bordered by the anterior edge of the sternocleidomastoid muscle and posterior belly of the digastric muscle. Laterally, superficial muscular epineurotic system within the subcutaneous tissue is present, and medially it is bounded by the stelloid process and muscles. The level 8 drains the efferents from the frontal, temporal skin, eyelids, conjunctiva, auricle, external acoustic meatus, tympanum, nasal cavities, the root of the nose, nasopharynx, and eustachian tube, and it receives its malignant deposits from the metastasis of the malignancy in the orbit, external auditory canal, and parotid gland, along with the other structures that have been mentioned earlier. The level 9, called as buccofacial group, contains the malar and the buccofacial nodes, and these are superficial nodes surrounding these facial vessels on the external surface of the buccinator muscle. It is bounded superiorly by the inferior edge of the orbit and inferiorly by the inferior border of the mandible. Anteriorly, SMAS layer is present within the subcutaneous tissue, and posteriorly it is bounded by the anterior edge of the masseter muscle and the corpus adiposum buccae. The lateral border is the SMAS layer and the medial border is formed by the buccinator muscle. The level 9 will drain the region of the nose, eyelids, and cheeks, and the malignant deposits will reach to level 9 from the metastasizing malignancy of facial skin, nose, buccal mucosa, as well as maxillary sinus. The last group is level 10, which is called as posterior skull group, and it includes 10A and 10B. The 10A group is called as retroauricular and subauricular nodes. It includes the superficial nodes on the mastoid process, and the boundaries are that it is superiorly bounded by the superior edge of the external auditory canal. Inferiorly, it is bounded by the mastoid tip, and anteriorly, the anterior edge of the mastoid and posterior edge of the external auditory canal is present. Posterior boundaries are formed by the posterior edge of the sternocleidomastoid muscle. Laterally, the subcutaneous tissue is present, and medially, splenius capitis muscles and temporal bone is present. The level 10A drains the regions from the posterior auricular surface, external auditory canal, and adjacent scalp, and it receives its malignant deposits from the malignancy of the retroauricular skin. Then the last group is the 10th B group, which is called as occipital node, and it is the superior and superficial continuation of level 5A, which is bounded superiorly by the external occipital protuberance and inferiorly by the superior border of level 5. It is bounded anteriorly by the posterior edge of sternocleidomastoid muscle, which is the posterior border of level 10A, and posteriorly by the anterior or lateral side of the trapezius muscle. The lateral boundaries are formed by the subcutaneous tissue, and medially it is bounded by splenius capitis muscle. It will drain the region of the posterior hairy scalp, and it will receive the malignant deposits from the malignancy of the occipital skin. So this was all about the levels of neck and the lymph nodes, which are grouped into different levels. It is remarkably well delineated, and it is associated with draining anatomic structure, which also gives us the idea of the primary malignancy and helps us in decision making as to which all lymph nodes have to be dissected during the surgical treatment of carcinoma of oral and maxillofacial region.